The health department in Limpopo has rescinded its decision to reopen the Ga-Chuene Clinic. This is after consultations with nursing staff there, members of staff, as well as general members of the public and labor unions. The clinic was meant to reopen yesterday on the 14th. However, that decision has been reversed. The department there saying that it has carefully considered issues of safety for staff members. Let's bring in the spokesperson for the health department in Limpopo, Mr. Neil Shukambana. Thank you very much for your time. You've decided not to go ahead with the reopening of the clinic. What were some of the reasons that informed that decision?
Well, the decisions that basically made us to come to where we are now is that we had to relook at the concerns that are raised by our employees with regard to what has happened and the effect that it has on their well-being. So we cannot discount that at the pressure of delivering services at all costs. While we need to balance the need to deliver services, we also need to ensure that we're taking care of the most important asset of the department, which is the human resource. So after re-evaluating the whole situation, we realized that probably the decision to reopen the clinic after 4 days was a little bit hasty, and we needed to take our time to allow the healing process to happen to our staff, especially the affected nursing staff. Also, we are counting on the South African Police Services to at least make headways with this case, because I think it will do a lot of good to the psychology of our staff members. So for now, that clinic will remain closed, and we will communicate in due course what's going to happen next. That's where we are now.
And speaking of the case, before I come to my next question, has members of the police reached out to you about where they are currently with their investigation?
Look, we are in continuous contact with the SABC with regard to the case, because while it is of great interest to us, we are happy that they are also prioritizing that particular case. And I might not be able to share the nitty-gritties and the modalities here in terms of how far they've gone, but we are happy with the progress that they are making, and we are hoping that very soon they should be able to make a breakthrough, which, like I've already indicated, will do a lot of good to all our staff members, not only at the Ga-Chuene Clinic, but bring that confidence in the work that police are doing in ensuring that there's safety in our facilities.
And lastly, what is then the way forward, looking at the fact that patients at the end of the day from Ga-Chuene will need access to healthcare services? What is the way forward?
As we had indicated when we closed the clinic temporarily, there will be a need for patients to utilize the clinics in the nearby vicinities, such as Block B, Soetfontein, as well as the Maja Clinic. I have seen on television, while you were speaking to some of them, saying issues of transport. Unfortunately, it's not something that we can be able to intervene. Also looking at the laws of the country, we are not allowed to provide taxi services, if I may put it at that. Suffice it to indicate that our ambulances will always be available in cases of emergency to take the patients that need emergency care to our casualties in our nearby hospitals.
Mr. Shukambana, thank you very much for your time. Spokesperson there for the health department in Limpopo, Neil Shukambana, saying that their ambulances will be available for cases of emergencies to transport and ferry patients to other nearby health facilities. For now, the Ga-Chuene Clinic will remain closed. We understand that the investigations by the South African Police Services are still ongoing.